So let us start. Good morning, good afternoon, and good evening, everyone. Today, the 342nd day of Zoom meeting of International Forum for Promotion of Homeopathy. So before starting the proceedings, let us have a silent prayer for a minute. Today, our chief guest is Dr.Arun Nair, MD Homeopathy, PG Diploma in Gerontology, MSW, Assistant Professor, Department of Medicine, Geriatric Clinic, in Unit in Charge, Cancer, Pain and Palliative Care Clinic, Medical Officer, Sadhana Homeopathy Medical College, Kanyakumari District, Tamil Nadu, India, one of the premier institutions of India. So he will present a topic on homeopathic approach to geriatric cases. Because we all know that the population of the persons coming under the group of geriatric aspect are increasing every year in India and all over the world. It's a very important topic. We expect nice presentation from you, Doctor. Now you can proceed, please. Come on.
Okay, sir. First of all, I want to thank under fraternity of Ifph for giving this opportunity for me. And in person, this is my first ever presentation before a mass. I used to take classes in UG and PG, but this is the first time I'm presenting or going for a discussion before a mass. So, such a I was a little bit panic. Anyhow, I'm going. So we know, sir, communication in English or in Malayalam?
It's English. This is English, sir.
Okay, sir. Okay. So we are very familiar with the term geriatric, as we have a very certain connection with geriatric people. That means old age persons in our home. That's the basic thing. So we met a lot of geriatric people in our life, in our consultation, or in day-to-day activities. So, but we didn't think about why this geriatric population is more prominent in the present era. And according to the latest statistics, India is said to be a graying country. Why? Because the major population of India is adult, and in adult, a major group is geriatric population, old age population, more than 60 age. And there is a contradiction that in our statistics, old age population is considered as the person who are above the age of 60. But here in geriatrics, the age is considered as above the 65 age. So that's the difference. But in statistics, above 60 we consider geriatric age group. But in medical literature, above 65 is generally considered as geriatric age group. So, road to discussion. What we are going to discuss in this section of 40 minutes. One is introducing a case. Through a case, we will discuss about what is geriatrics, what is the global incidence, what are the facts, what are the theories of aging, what is the pathobiology behind the aging and geriatric, what are the assessment tools we can use for geriatric consultation, what are the findings. Some findings I want to show some statistics that made from our institution, an observation study. So some statistics relating that observation. Then geriatric medicine, materia medica. Then homeopathic approach, how to approach a geriatric cases. A lot of controversies are still persisting in treating geriatric cases. Then analysis of the first case, that is introducing case. Then a recommendation for geriatric people, and finally for open discussion from attendee regarding the experience. Because why this last section is added is, I have only an experience of 3 to 5 years. I completed my PG in 2016 last and joined in 2017. So I have an experience of 4 years. And in geriatric, I have experience nearly 3 years only. So most of the persons who are attending this section are more experienced than me. So I want to I wish to get some their experience sharing also. And what is the objective of the study is, in the final, we should need a better understanding of geriatric under homeopathy perspective, a better understanding of pathophysiology, knowledge about geriatric tools in the bedside or clinical side, and improve the practice or change our attitude to geriatric people. So A case. This is a case I attended. A 67-year-old male patient was brought to hospital by his brother having complaints of joint pain since 6 months, memory impairment since 3 years. He was diagnosed to have uncontrolled hypertension and was under allopathic treatment, not was, is under allopathic treatment since 8 years. Type 2 diabetes mellitus since 4 years under allopathic medication. Coronary history of coronary artery disease, old history of MI 2 years back under allopathic medication. Then hypercholesteremia 4 years under Ayurvedic medication. Acid peptic disease and around 6 years under Ayurvedic medication, and history of hemorrhoids since 3 years. And the quality of hemorrhoids is on and of nature. They didn't get any proper medication for this, but sometimes they confer for Ayurvedic treatment. And in general, patient was uncooperative and difficult to give answers. He was looking so irritable. He never gave any simple face to us. He didn't give silly answers. He always in a hasty talk. He don't want to give any answer. And family history. Patient was diabetic mellitus, patient of diabetes mellitus, hypertensive, tuberculosis and cancer among family. First order relationship, have tuberculosis and father had cancer. And he belongs to middle class, moderately nourished, place of birth in Kulashekaram district, and education up to 10th. Marital status, he is an widower. And habits and hobbies, he is taking alcohol, cigarette smoking, in nearly around 20 pack of year pack. That means 20 pack year is the total assumption for this patient. That means one day patient used to use or smoke 1 packet of cigarettes. So this happened through 20 years. So it is termed as 20 pack year. In general, patient appetite is decreased, eat 2 to 3 times daily, but only 2 to 3 times. And thirst is increased 2 to 3 liter per day. Stool, increased frequency of passing stool, passes 3 to 4 times per day. There is no history of tenesmus or anything like that. History of pain and tenesmus is there. Then urine regular pass 3 to 4 times. Normal quality. Perspiration, generalized perspiration all over the body. Sleep disturbed and sleep for only 2 to 3 hours. And thermals are hot. And his desire for getting salty food, spicy food, especially fish, fried fish. And in mental, desire solitude, desire closed room, hours to talk. And this hours to talk and giving answer is an observation from our side. And in general physical examination, mild pallor, and all other are normal. Then BP elevated 162/92 mm of Hg, pulse rate 64 per minute, regular, normal rate and rhythm, with no radial delay and no radiofemoral delay, and respiratory rate is around 16 per minute. And in appearance, he is a thin, alert, older Asian male in an no apparent distress, but unpleasant and poor corporation and notably flat affect. CVS, normal S1, S2, no murmur or gallop ruled out. Respiration, NVBS, that means normal vesiculobronchial breath. And in GI examination, normal bowel tone, soft, non-tender and non-distended. Muscle strengths are normal. Neurologic cognitive screen, that means immediate memory 3 to 3. All other tests are neurological aspects are found to be normal. And in mini mental state examination, score of 15 out of 30. So if it is between in between 90 to 23, it should be considered as a moderate cognitive impairment. And in clinical dementia scale, is a score of 1. It's showing a mild cognitive impairment. Clinical dementia rating sum of box score is 4.5. It is a very mild dementia. And in geriatric depression scale, there is 12. 12 means mild depression is there. So these are the findings from this particular case. And at first visit, I personally think this patient is little bit restless and irritable, and he don't want to cooperate with us. And we consider this case as a one of the troublesome case that we are attending or we are going to attending in the scenario. And what we think is such an irritability, such an rude, no kind of diffusion with us. Even though he is sick, while we ask about thing, he will tell nothing for me. My younger brother asked to come, so I came. That's his answer. Such a way he rudely presented. So it literally irritated us a lot. At a point, we think it is better to skip this case. He should be advised to another faculty. Such a wise we thought. And in other side, we think we are doctors, so we supposed to attend the case. And in CT, there is a generalized brain atrophy is the CT finding. So this is the among the geriatric case I have experience and I want to present before you people. Then I am stopping this discussion here. Then we are going to general topic. What is geriatric? Geriatric is basically a specialty of medicine that is concerned with disease and health problems of older, those who are above 65. And it is a subspecialty of internal medicine, but unfortunately, geriatric courses are very less in India and very mild. A very few number of institutions are running geriatric clinic and geriatric courses in India. And in homeopathy, I think no such plan or happen in our curriculum or in hospital side. And aging may be considered to be the loss of adaptability of any individual with time. This is the easiest way to understand. It is incapability of a patient to adapt with its need. That is the basic thing we can consider as geriatrics. Then according to world population, globally around 703 million older persons aged 65 or over in 2019, and over the next 3 decades, that means up to 2050, it is considering that 1.5 billion of population will be geriatric group. All regions will see an increase in the size of their older population between 2019 to 2050. The largest increase is projected to occur in Eastern and Southeastern Asia, growing from 261 million in 2019 to 573 million persons aged 65 years or more at 2050. So that is the statistical evaluation. It is telling that at 2050, around majority of the population in the globe is filled with geriatric persons. So that's the reality that we are facing in 2050. And I myself think I will be the one among the person in that period, 2050. So that is the reality in world. And what about in India? In India, 2019, there is over 139 million population of geriatric population. That's contribute about 10% of the total population in the country. And in 2050, it seems to be 19.5%. That means 319 million population of people over the 60 age. That's why now itself India is said to be a graying country. That means premature population is going on. Birth rate is increased, but death rate is not increased. So the population, birth and death of the population is entirely different. And in Indian statistics, the life expectancy of male is now is 68.11. That means average age. The life expectancy of female at present is 78. And this expectancy will increase to 73.6 in males and 77.25 in females. So now the average of the life expectancy is said to be 62, in between 60 to 70. Definitely it will change it to 70 to 75, and in case of female it is between 65 to 75. Definitely it will change it to 75 to 85. So what happened is old ratio will be drastically more than that of birth rate. So that's what we are going to face in upcoming year. But unfortunately, we didn't have any kind of things or stuffs in our country for regulating or for managing this distress, population distress. So next, some facts relating to geriatric population. That's we earlier discussed. That means for men, the life expectancy is 16 year at the age of 65 and 9 year at the age of 75. For women, life expectancy is 19 year at the age of 65 and 12 year at the age of 75. Simply telling that if a person attain age of 65, the chance of living is adding 16 year to existing one, and in age of 75, the life of chance is +7. That is maximum expectancy up to 84. That is statistical scenario. And in case of female, in 16 they can live 19 years more. That is average in female. And in age of 75 they can extend their life up to 87. The women tend to live longer than men. Why? Because of their hormonal variations. The menstrual cycle kept them alive in many aspects. So because of the physiological prominence, female will live more than men. At the global level, in 2015-2020, women life expectancy at birth exceed that of men by 4.8 years, probably because of genetic, biologic, and environmental factors. These differences in survival have not changed despite changes in women's life cycle. So in earlier eras, we didn't think women will have the quality of alcohol intake or smoking or increased stress. Anything increased stress was there, but other life pattern or habits and hobbies are very less. Even though nowadays these habits and hobbies are increased, but they didn't affect the life expectancy of female. The maximum lifespan estimated at 110 to 120 year has increased modestly compared with the substantial increase in average life expectancy during this century, but continues to increase without slowing the rate. For normal life in earlier, the life expectancy is considered between a normal human life expectancy is to be up to 100, but it is telling that it is estimated to be in between 110 to 120 year, even though the rate of birth or the birth rate is not even in control. The rate of above 65 are better health than their predecessor and remain healthier longer. So in previous or past era, if we gone for persons above 65, they are little bit, we consider they are healthy, but medicine is telling that they are not at all healthy around 65. And it is telling that in future, the persons above 65 is healthier than us and our predecessor. Because of this improvement in health and decline tends to dramatic in the oldest old. So maximum in 250 or more, we can see many of them having age above 100 years. Now very rarely we can see such kind of persons in our region, but in near future it will be common. And next is medical part. What is basically aging means? What is the technical behind? What are the techniques that work out behind the aging? So in medical situation, the biological concept of aging is determined under two theories. One is programmed theories and other one is damage and error theories. This programmed theory means it is considered with some genetic expression. Now, if we refer most modern medicine books, they will explain every disease in terms of genetic expression. If we search for cancer, they will tell TP53. That means tumor protein 53 is the one among the major gene that can cause cancer. If there is any mutation happen in T353, it leads to formation of a cancer in a normal person. So everything explained in terms of genetics. So such a way, it is telling that there is this program theory is telling that already our genes have some programs. As part of this program, we met to apoptosis, and we met to, that means the patient, they get type 1 diabetes mellitus at the age of 20, even though they didn't have any familial history or first order, second order familial history, but this genetic expression caused the same. So such kind of genetic expression is the responsible for forming aging or adulthood, apart from the defense responses. So this is the programmed theory. And damage and error theory means because of some environmental factors that assault to the human being, that causes the changes in the health and develop to aging. And best example is this one, multiple sclerosis. In case of multiple sclerosis, it is telling that those who are very less exposure to sunlight are more vulnerable to get MS, multiple sclerosis. An example for how environment pretend to that. And we have asthma. Those who have full moon and new moon, they get asthmatic changes. They may happen allergic changes. So this environmental factors, involvement of environment factors on and its expression on our human body leads to some complication chain changes. That is the content in damage or error theory. So these are the principal theories related to aging in modern biological concepts. Then come to our concepts. What is programmed theory? And this program theory is proposed under 3 subcategories. One is program longevity. That is, program longevity means here there is a sequential switching of on and off of certain genes, with senescence being defined as the time when age-associated deficits are manifested. That means, just like thyroid, if there is a demand in thyroid, at that time our pituitary gland will receive the chemoreception, and as part of that, pituitary gland will trigger the thyroid gland to produce thyroid hormones. Such a same happened in pancreas also. So it is telling that there is a program in relation with body connectivity when this particular function will happen in the body and when this particular function won't happen in the body, without any environmental factor, only depending on bodily factor. So this is the programmed longevity. And endocrine theory, just like that. These hormones are controlling the rate of aging. We know growth hormone, thyroid hormone for attaining maturity and other thing. Then aldosterone hormone for maintaining renal functions. So many hormones, endocrine hormones, are maintaining this particular function. That means that particular function in the bodily process. Such theory is included in endocrine theory. And the immunological theory is telling that while the age advances, because age advances, our immunity become very less and we become more susceptible to get disease. So because of this, we may get infection, and as part of that, we face death. That is the immunology. These three are the subcategories in programmed theories. And in tear and wear theory means damage and error theory. First one, tear and wear. Just imagine we have a car. We can run our car. Some company give 1 lakh kilometer. Some may give 1.5 lakh kilometer. Some will give total guarantee for 2 lakhs. Some will give a lifelong guarantee. But even though our country decided that after 15 years, we are not supposed to use our car. So this tear and wear is among the reason for the damage and error. Next one is right of living theory. This is a controversial theory, but it's a fact. That means those organisms which have a slow or respiratory rate can live longer. Just like turtle. Turtle can respire very slow, so that they can live nearly more than 200-500 years. That's our basic, our yoga and other things are happening also. While we're doing yoga and meditation, our respiratory rate become very subnormal, and as part of that, we can increase our life expectancy. So this is the role of living theory. And then next is cross-linking theory. This is one of the complicated theory that as for any disease, there is a chemical activities are there. Imagine once we can run a 20 stair in our age of 20, we can easily run it. Imagine at the age of 85, this body have some clearance mechanism. That means scavenging mechanism. Once a medicine, this knee pain will relieve in next day because of the clearance mechanism. But with advances, this clearance mechanism won't happen. And as part of that, oxygenated phosphorylation won't happen. And because of that, cross-linked proteins will happen. That means cross-linked protein, it is easily telling that unwanted amino acids will produce inside the body. And these amino acids may cross-link with unwanted chemical biological factors. And this forms oxidative stress in the body. And this oxidative stress leads to the free radical formation. And finally, this free radical formation leads to the unusual inflammation. And this unusual inflammation leads to the permanent death of that particular organ or particular cell. This is happening in every disease. In case of brain, in case of heart, in case of liver, the disease aspect is unwanted chemical and inflammatory process formation. That is the basic reason behind every disease. That is the basic reason behind aging also. That's free radical theory. I already said oxygenated phosphokinase will phosphorylation will happen. It leads to free radical formation. Oxidative stress species, reactive oxygen species, and it leads to the formation of free radical. And what happens? This free radical will cross-linked with DNA. That means it cross the barrier of the cell and get into the nucleus, and it change the DNA sequence. That means mutation in the DNA sequence. So this is what happened in the disease, and also happened in the aging, and also happened in the death. So this is the two biological theories explained for aging. So this is the pictorial graph. Genetic expression, environment impact, contributing to human cells, which leads to many chemical processes. As part of that, unusual oxidative stress happen. As part, more of free radicals are formed. This free radical initiate to formation of pro-inflammatory factors, cytokinins, decrease in the antioxidant, and it leads to primary inflammation. If the conditions are not favorable, these changes will become irreversible, and which leads to permanent changes in that particular cell and particular organ, and leads to that. This is what happened in MI, then stroke, every in liver cirrhosis. Everything is happening basic mechanism. So contribution of aging, or what is happening in this particular areas if aging is happening. In body composition, we know there are large contents of body compartments are there, fluid compartments are there. We used to sell extracellular fluid, intracellular fluid, interstitial fluid. This body compartment will change, and susceptibility of dehydration is more, and patient become easily dried, and general strength become less. And in case of cells, this unusual mutation may lead to cancer risk in the body. And in CNS, tendency to degenerate the neuronal cells, and which causes the neurological changes. In case of ear, sensory neurodeficit will happen, leads to inability to receive voices. And endocrine gland, this hormonal changes will happen in the body, and as part of many chain of things happen in the body. In case of female, there will be menopause, followed by that osteoporosis will be there. Then osteoporosis leads to a decreased bone mass, and it tends to fracture risk. Falls, tendency to fall leads to fracture, and luster of the skin will lose, and the susceptibility of water intoxication will be there. So such kind of many things happen as part of endocrine. And if it is happen in hepatic and pancreatic level, it leads to diabetes also. And in case of eyes, there will be cataract, then visual acuity differences, then color differences will be there. In case of GI, main thing is absorption error, and defecation error will be there. So serial followed by constipation. And in case of immune system, our immune system will be very less, and as part of that, we are more vulnerable to get disease. And in heart, the capacity of the myocardium will become less, and as part of that, cardiac output will become very less and leads to ventricular and atrial changes, leads to fibrillation and ultimately to the death of the patient. And in case of joint, degenerative changes may happen because of many chemical processes, including hormonal process. This leads to the joint space reduction, and basically it leads to spondylotic changes. We called as spondylosis, lumbar spondylosis, or OIF knee. Anything will happen in relation with joints. And in renals, the marked decrease in glomerular filtration rate, and it leads to deficit in the electrolyte imbalances, and which cause to, and the use of unusual or unwanted drugs may leads to renal impairment. One among the main feature of ill health. Then in liver, metabolism will be deranged, regular metabolism will be reduced. In case of smell, thickening of mucosa leads to decrease in the sense of smelling. And in vasculature, susceptibility to hypertension, that means atherosclerotic plaques or atherosclerotic changes will happen in the blood vessel walls, and this leads to other kind of changes. In peripheral nervous system, baroreceptors will be affected, and as part of that, exaggerated response in very small actions, then patient are susceptible to get syncope. And in case of pulmonary, their vital functions will be less, and the chances of getting pneumonia and other respiratory diseases are more. So these are the impact of geriatric changes or aging changes in particular system in our body. And this is all up to mechanism or impact of geriatric in human body. Then for clinicians, how to evaluate a geriatric patient? We have enormous laboratory facilities in nowadays. In case of stroke, we will ask patient to went for MRI or CT. In case of CKD or generalized anasarca is there, we ask them to go for an ECG, for liver function test, for renal function test. And in case of unusual pain or unusual weight loss, we will ask them for a CT or MRI related to that particular area to rule out the CA. So such kind of very vast laboratory findings are available. But in case of cognitive and other, we can't do any kind of laboratory or blood investigations. One, such kind of advancements didn't happen yet in the medical field. So we are using common tools to diagnose the geriatric issues. One scale is Vulnerable Elder 13 survey. This included a 13 questionnaire which used to identify the vulners related to geriatric population, old age population, related to fall, related to autonomic function, related to mindset, everything. Then comprehensive geriatric assessment. This is a most common tool used in the bedside to a total assessment, living standard, psychic features, physical activities, pain, their social, their economic, every aspect we can assess through CGA. Then daily activity of life, ADL scale. This is the scale used for assessing the activity of the patient. Then rapid geriatric assessment scale. It is a clinical or a mini format of CGA. We can use easy assessment in clinical side. Then mini mental state examination in related with neurology, mini nutritional assessment, then timed get up and go. This is used for locomotor function, whether patient can walk, whether there is any cerebellar involvement is there. Those things we can done through timed get up and go scale. Then cumulative illness rating scale for geriatric, considering all the vitals organ inside this questionnaire. Then quality of life questionnaire to assess the quality of life. These are commonly used for identify the success of treatment, whether it is good or bad, outcome is good or bad, such a thing. Then for geriatric depression scale. Geriatric depression scale in short form. This is also used in the clinical side for easy assessment of the particular patient. So these are the basic scales and tools we are using bedside for assessing psychomotor assessment of the geriatric cases. And this is an observational study that conducted in medical OPs of Sharada Krishna Homeopathic Medical College. it is from our finding, I'm telling why I'm telling this is the one among the socio-economic status of the persons in South India, not in merely what to tell adaptable to entire population, but some group of population it is representing some group of population. In our study, there was 104 male, that is 48% was male and 52% was female, and in age distribution only 2 cases, that means 92.92% from above 95, 85 to 94 age 17.92%, 75 to 84 30.88%, and 65 to 74 around 50.23%. In all, majority are from female side. Female patients are more than male. So many factors are there. Maybe men go for any work, or they are dejective to this kind of treatment. They don't need any kind of treatment. They think themselves that they are okay without treatment. So many factors are there. We didn't go for what are the factors inside this, but from this study we found out that females are more in habits and hobby. In this area, alcoholism, 21% for alcoholism, 15% in smoking, including cigarette or BD, and betel or quit chewing, 11%. That means a very small fragment of persons are still using, and in this both males and females are included. And pan usage, males are more, around 6.45% are using pan also, even though pan is banned in many of our areas, but it is readily available now also. Common diseases. So most common disease we identified in the clinical side is GI complaints. Maybe because of overuse of any medication or any stress, anything like that. But GI complaints are most frequent one we received from this bedside. Then second one is musculoskeletal diseases. Then third one, hypertension, around 59%. Then diabetes mellitus, 54%. Visual disturbance, 48%. Then respiratory complaints, 48%. Dental complaints, 48%. Dyslipidemia, hypercholesterolemia, around 45%. Then neurocognitive impairment, including sleep disturbance, 45%. Hearing disability, 45%. Then skin and all other complaints, around 40%. Then genitourinary complaints, around 28%. Obesity, 21%. Dementia, 14%. Hepatobiliary complaints, 11%. All type of cancer, around 10%. Then coronary artery disease and other structural cardiac illnesses, around 7%. And stroke, only stroke, around 3.7%. So this is the predominant diseases that commonly reflecting in Indian population among the geriatric people. In this lifestyle, we can consider diabetes, hypertension and diabetes are more, but we are more focusing in lifestyle disease, but we didn't neglect other diseases too. That's why I used to present this one. And in distribution of marital status, around 24% was widow or widower. So there is the scope. I think there is the scope of homeopathy or a social support is needing area. Then daily, in case of occupation also, around 43% are mechanical, more mechanical working, and around 36% are a minimum kind of mechanical working. At 12% didn't have any job. Retired from private job, 5.5%, and retired government job, 1.8%. So we can tell this cost of treatment directly depend with the income of the patient. So this is the income scenario of the patient, but treatment cost didn't change at any point. And in dependency, around 51% are partially dependent. 31% are totally independent at the age of 65 or over 65, and 17% are totally dependent. And some homeopathic medicines are there for using geriatric or old age population. Even though we know we can use all medicine based on the totality of symptom, but some medicines are pointed in boric or other homeopathic materia medica regarding the use in old age group. First one is I am introducing is ambra grisa, indicated for nervous complaint of old people, especially when they are forgetful and cannot remember the simplest fact. Vertigo comes on when the patient moves about and the legs are unsteady. Totters when he walks, numbness of the feet and tingling in the limbs. The limbs go to the sleep readily. Functional and organic weakness of cerebrospinal nerves. That is the main thing. If the patient having a functional or organic brain changes, we can go for ambragrisae. But I'm not telling this is a medicine for old age. In treating homeopathy, we can go for totality. This is only a supplement. We can't tell this is the medicine only for that thing. We can use Naxomica, phosphorus, anything for this kind of changes. But in boric materia medica and other materia medica, it is readily available. This is same in aurum mat. Some mental features, psychic features are more in case of aurum mat. We can consider aurum mat in psychosomatic approach with bone and cardiac diseases too. Then come Beretta curve. We all know with Beretta. Then Cali group, we know about Cali group. Coca, we know about cocaine group. Then opium, very familiar medicine in case of opium. And some other medicines I didn't mention, just like we used in our ICU, hydrocyanuric acid, larosarosis, amyl nitrosum. These are the best medicines that give us very valuable result in case of end term of the patient, as well as unconscious or clueless patients. So this is the one for we all know in Ken repertory in page number 130,376. We get this one rubric, old people. So this thing I included.
Yes, Dr. Arun. Now we have to
Yes,
go
sir.
for discussions.
Okay, sir.
For the discussions now, for 15 minutes remaining.
Sir, we will. If possible, we can.
Well, I think we can have another session in lesser parts.
Okay, sir. Like that. No matter.
Very nice presentations. There's a lot of things to learn, I think, and very large number of information. So this shows about the importance of specialties in homeopathy. He learned a lot of things. A lot of things. So those who are interested in participating in the discussions can go to the participant list and please raise your hands. Dr. Arun, you don't have any hesitations or inhibitions are there. So nice to see you, because a student from the Saradash Homeopathy Medical College is performing well in a very different topics. It is absolutely novel for us because we have not studied all these things at that time. Very nice presentations.
Thank you, sir. Thank you.
Then what about your case that you have all the first case you presented? What was happened later?
Sir, basically, I went for further interview. I skipped for 2 to 3 visits. Sir, 1 minute. I will give the case.
Okay.
Sir, first we give. I didn't get any particular clue from that particular case. Only a family history of tuberculosis and cancer. So to get a proper simillimum, I advise tuberculinum in lower potency as age and susceptibility are more. Then what I technically done was I used to become more familiar to patient. I used to call uncle, are you okay? Uncle, how are you? Most time he reproaches to me, but later I don't know, he gradually shows some affection, and then only I came to know he lost his a very tragic family. He lost his son and wife, only son and wife, at the age of 45 in an accident. From that he changed everything. He started to live alone. He don't want to interact with anywhere. From that point he started diabetes, hypertension, something like that. So we think it is more need to give a physical companion rather than a medical approach. So I use around 20 to 30 minutes for this particular patient in each visit. Mostly he will come once in a month. So most of the time I used to sit like a brother or like a son. I used to inquire about his matters.
Yes. Then what happened? What was the conclusion of the case?
Sir, in tools, Finally, we give natramur and robina tinge also we gave. In tools, this is
Manoj.
one attitude change a lot.
Sir, now is Dr. Joseph, sir. Please, you can answer the question.
Joseph.
Hello. Hello,
I don't know,
Manoj.
sir.
Yes. See, your presentation was very good. I would like to know your experience with our traditional geriatric medicines like Barita carb, opium, carbovage. Have you seen any good results with that?
Sir, I didn't get anything with Beretta car, but I found a good result in opium. A grandma of age of 87, he was under allopathic treatment, came to our hospital as unconscious. We go for some medicines just like this one, Adsal, amyl nitrosum. They didn't work. Then in between, then she's used to sleep a lot. A stuporous kind of sleep. He didn't wake up, he didn't identify anyone. So then, with the help of our chairman, Dr. C.K. Mohan, he advised opium 30 in repeated doses. Then what happened is, next day, around 48 hours or 56 hours later, this grandmother wake up and she used to tell unusual things, just like showing some kind of excitancy. Then we stop the medicine and then we go for opium 200 after around I think around 2 to 4 days after. And such a way I saw miracle changes in case of opium. And in case of one case with carbovage as well as Veratrum, we gave 2 medicines at a time. A patient brought to hospital at unconscious. Case was attended by Dr. T. Ajayan. He went for basic calculation and we didn't get any proper finding. Then we connected monitor and everything, ECG including everything, and we give amyl nitrosum and carbovage on our interval in a recurrent way, and this give a drastic change, and this person is still alive. And this ECG was shown very less changes. So we suspect this patient will end his life within a couple of minutes. But this amyl nitrosum and carbovage changed everything. But what happened is we gave, what is the matrix? We gave in tincture form, not in potentized form.
Okay, sir.
That's only change.
See, one more
Sir.
question. See, have you seen in Alzheimer's, usually what we see is medorinum and Barita carb is working well. Have you experienced such a result?
Sir, I personally blindly prescribe these medicines for Alzheimer's, but advanced stage of Alzheimer's, I didn't get any changes, sir. Mild form of Alzheimer's, I think maybe any my physical thought or anything else, I find a mild changes in mild case of Alzheimer's, but in highly developed or fully developed Alzheimer's, I didn't find any progress. Sir. I'm really sorry to say, maybe my technical error, I didn't get it. I'm a huge failure in fully developed Alzheimer's.
Okay, then thank you very much.
No, I am in travel. I'm in travel. That's why I have to do like that. And that's all. No questions because I'm not attending the whole speech from Manoj,
Ismail sir, don't ask any question. I am little bit panic while seeing you in my screen. And Joe sir also, please don't ask any questions. I don't have any clinical experience as you people. Sorry, sir.
You learn more and you are told some very, very miraculous things. So I'm very happy with you. That's all.
Thank you, sir. Thank you.
Yes, sir. So if anybody is there, you can ask questions. Please raise your hand.
Sir, ഇനി ആരും ഇല്ലാന്ന് തോന്നുന്നു സർ. നമുക്ക് കൂടുതൽ ഡൗട്ടിലേക്ക് പോകണം.
829.
Yes, sir. Dr. Shaji Kudiyat, doctor, please, what is your opinion?
ഷാജി സാർ ഓൺലൈൻ ഉണ്ടോ? അയ്യോ,
നമസ്കാരം. ഞാന്
നമസ്കാരം സാർ.
കേൾക്കുന്നു.
ഡൗട്ട് ഒന്നും ചോദിക്കരുത് സാർ.
ഇല്ല, ഡൗട്ടൊന്നുമല്ല. I just want you to bring certain points or areas into your attention so that in your future studies and observation, you can make use of these ideas because
Okay sir.
certain
Oh, okay
areas,
sir.
yeah,
Okay.
because the role of the mind, I am watching your presentation where you are mentioning things mostly connected to the material scientific perspective, where the biochemical changes and all these things you are following. At the same time, the peace of mind, the role of the mind in the functioning of the physical brain and its contribution to an aging or anti-aging process should be studied in detail as part of holistic science-based studies.
Okay sir, definitely sir.
Homeopathy is a holistic science where we need to incorporate the role of the mind and vital force in the functioning of the physical plane, which are
Okay,
not
sir.
happening today, which need to be incorporated, and our responsibility and role is very important in that area. So I wish you to
Okay,
look
sir.
into that areas. Then
Definitely,
another
sir,
thing I
definitely.
observed in geriatric problems today is sexuality, connected to sexuality.
Okay sir. Okay sir. Okay.
That is an area nobody wish to talk, but plays
Yes,
very
sir.
very important role in aging people.
Yes sir. Yes sir. Yes sir. Yes sir.
Because sex is a biological need, and that a part of the natural desire is
Yes, sir, yes,
not
sir.
fully functionally fulfilled in old
Yes,
age.
yes.
But nobody is properly looking into that area, and that is creating a lot of complications, disease, and unhealthy situations, and even family conflicts that leads
Yes,
to
yes, sir.
physical ailments also.
Oh.
But that is an area need to be studied in detail, and
Definitely.
solution need to be suggested, and awareness need to be produced among the society, old age people.
Yes, sir. Yes, sir. Definitely, sir. I tried to find out, but most of patients are shy to express. So
Understand.
that's why I use GU complaint, genitourinary complaints. Apart from sexual complaint, most of them are sexual complaints. Some few cases are prostate related complaints. Apart from that, many of them have this complaint. Males may open their mind to an extent, but female won't. So I tried my best, but I didn't get.
And also
So
another
next time I will focus main, sir.
yeah,
I will
and
focus it
also,
mainly.
also another thing I noticed is many of our older women, some of them are undergone hysterectomy, total radical hysterectomy, that
Yes, sir.
leads
Yes, sir.
to lack of production of female sex hormones.
Yes, sir. Yes, sir.
For
Sir.
them, sexual functions become more difficult.
Yes, sir. Yes, sir.
And that is also because when there is a myoma, which the modern medicine people don't properly understand how this myoma develop, or
Yes.
there is some ovarian problems, they don't know the cause of such problems. So immediately what they do is they cut and throw such organs which have very important functions to fulfill the entire life of that lady.
Yes, sir. Sir. Most of the men, a few number of patients underwent hysterectomy before the age of 45 in this study,
Exactly.
but I didn't include it.
Yeah, that has so much impact in the rest of their life.
Yes, 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 sir. Definitely, yes.
Especially in the sexual functions.
Yes.
So we need to study and contribute the outcome to the awareness of the public, so that these unwanted surgeries needed to be avoided, and the role of such organs in the healthy existence of men and women need to be explained to the society and the world at large. Such
Okay,
things
sir.
are not happening, and these are need of the hour, and very needed for healthy existence of an old age
Population.
generation, old age
Yes, sir.
generation. So
Yes,
these are
sir.
the few things I wish to bring to your awareness, so that you as a young dynamic homeopathy doctor entering to this big area will be able to develop further researches and contributions to the world of medicine. And I
Okay, sir.
appreciate you to look into these areas.
Thank you,
you.
sir. Thank you, sir. Very
Thank
thank
you.
you, sir.
Thank you. Thank you.
Dr. Thanesh is raising hands. I think Dr. Thanesh can participate in the discussion as well as say the vote of thanks. Thanesh, Doctor, please.
Good evening, all. It's a very good presentation by Dr. Arun Nair. It's a very relevant subject also because we have nearly 30% of people are more of geriatric people nowadays. So you have shown the relevance of or the importance of taking care of those people with our homeopathic medicine, and this is one of the area where we need to concentrate more and more, and so that once we get a patient like this, a person from old age, he will be able to get the whole family into our system, and that will definitely a big boost for us. And this is what happening with me. I have a lot of geriatric patients, and they're all doing well. So most of them we used to get once they become unconscious, or sometimes they may become
Yes, sir.
half half sleep condition or like that.
Yes, sir. Stupor
So
condition.
in
Yes, yes.
in a comatose stage or that. I have used opium varnam as one of the best favorite
Wow.
remedy, and that remedy has saved so many lives in my experience. And I have an experience of nearly 36 years of practice, and I was concentrating. I have several videos with this. I have presented one of these case in my earlier presentation here also.
Okay,
With
sir.
a patient who was just about to die, was saved by homeopathic medicine, and at that time the medicine saved him was opium. And that remedy was carbamide. He was a typical carbamide patient. When body was icy cold, and everything was, the fan was in full speed, but the patient is unconscious, and the carbamide saved the man, and he lived for nearly 5 more years, and he was taking nearly 33 tablets a day.
Oh, okay,
And
okay.
I was able to stop all those tablets because of that. Because of taking that, there was bullous pages, and the allopathic people were not able to cure that. But fortunately, we homeopathic doctor, as a homeopathic, I am proud to say that we were able to cure that with homeopathic medicine. So
Yes,
this
sir.
is the beauty. So thereafter, I got a chain of patients from that family, and now
Okay.
all members of the family are taking homeopathic medicine. This is,
Wow,
and
that's
not only
great, sir.
that that person is doing great service to homeopathy also. So this is what I want to say, and you have shown you have, but you may once again come to this platform to elaborate your scientific theories on that. Of course, and one more thing I would like to add is here is that most of the patient in the older age require this some Netromor 3x. So because most of the patients are getting sodium depletion, so sometimes they may be hyponatremia. In those
Yes, sir. Yes,
conditions
sir.
where Netromor 3x works wonderfully, and I used to give Netromor 3x in those conditions where the patient is in hyponatremic condition. So this is one of the area you need to concentrate, and these are some of the points I would like to add for this session.
Definitely, sir. Definitely.
And anyway, I congratulate you for, and you are very young, and you look young also, and you are, but don't be ashamed. But you come forward. No need of facing any challenge from our big. We are not a big threat to you, but we are just assisting you. Now we are here to assist you,
Okay.
so that
Yes, sir.
homeopathy will be the winner here. We want to say that we want to see homeopathy is the number one in the future. So it is in your hand, homeopathy. So what we are doing, we are ready to deliver whatever thing with us. So this is the only point I would like to mention here. And thank you once again
Thank you,
on
sir.
behalf of IFBH as well as my behalf. And thank you everyone for participating in the discussion, and enjoying the beauty of this homeopathic science here. And IFBH has done wonders here and you may please visit the site every now and then, so that you can also get a good clues about our system from different persons all over the world. So this is an area where you.
Okay.
Thank you.
Yes, it is time to wind up.
Thank you all.
Yes, time for to wind up the session. Day 342 is a nice presentation. So thank you once again, all the participants. Please over to you, Dr. Binraj. Thank you.
Thank you,
Am I audible?
Yes.
sir.
Thank you, Dr. Manoj. International Forum for Promoting Homeopathy മലയാളം സെഷൻ ആരംഭിക്കുന്നു. ആദ്യമായി മൗന പ്രാർത്ഥന. എല്ലാവർക്കും നമസ്കാരം. ഞാൻ ഡോക്ടർ ബിന്ദുരാജ്, ഇന്നത്തെ മലയാളം സെഷന്റെ മോഡറേറ്റർ. ഇന്റർനാഷണൽ ഫോറം ഫോർ പ്രൊമോട്ടിംഗ് ഹോമിയോപ്പതി ലോകം മുഴുവനുള്ള ഹോമിയോപ്പതി സ്നേഹികളുടെയും ഹോമിയോപ്പതി പഠിതാക്കളുടെയും ഹോമിയോപ്പതി ഡോക്ടർമാരെയും കോർത്തിണക്കുന്ന സംഘടന. ഇതിന്റെ ഒരു ഇന്നത്തെ സെഷൻ എന്ന് പറയുന്നത് 342ാം സൂം ദിന മീറ്റിംഗ് ആണ് ഇന്ന് നടക്കുന്നത്. ഈ സംഘടനയുടെ കർമ്മമേഖല അനുദിനം വളരുകയാണ്. ഹോമിയോപ്പതി ചികിത്സാ സമ്പ്രദായം മറ്റ് ചികിത്സാ സമ്പ്രദായങ്ങളുമായിട്ടുള്ള അതിന്റെ വ്യത്യസ്തത, അതിന്റെ മേന്മ, ഇതൊക്കെ ഇവിടെ പഠന വിഷയമാവുകയാണ് ഇവിടെ എല്ലാ ദിവസവും. ഇന്ന് നമ്മളോടൊപ്പം ചേരുന്നത് ഡോക്ടർ പ്രസാദ് ഉമ്മൻ ജോർജ് ആണ്. എല്ലാവർക്കും ഹോമിയോപ്പതി മേഖലയിലെ എല്ലാവർക്കും സുപരിചിതനായ അദ്ദേഹത്തെ ഞാൻ IFPHന്റെ ഫ്ലോറിൽ പരിചയപ്പെടുത്തുകയാണ്. ISKയുടെ ടീച്ചിങ് ഫാക്കൽറ്റി ചെയർമാനും സയന്റിഫിക് സബ് കമ്മിറ്റി ചെയർമാനുമായ ഡോക്ടർ പ്രസാദ് ഉമ്മൻ ജോർജ്, മുൻ ചീഫ് എഡിറ്റർ ISK ന്യൂസ്, സ്റ്റേറ്റ് പ്രസിഡന്റ് ISK എന്നീ മേഖലകളിൽ പ്രവർത്തിച്ചിട്ടുള്ള ആളാണ്. ക്ലാസിക്കൽ ഹോമിയോപ്പത്തും ഹാനിമാനിയൻ ഹോമിയോപ്പതിയുടെ പ്രചാരകനുമായ അല്ലെങ്കിൽ പ്രയോക്താവുമായ ആളാണ് ഡോക്ടർ പ്രസാദ് ഉമ്മൻ ജോർജ്. ഇന്ന് അദ്ദേഹം ആദ്യത്തെ